Hello everyone, I'm Dr. Adam Maulana. How are you today? I hope you and your family are always blessed with good health, peace of mind, happiness, and protection in everything you do. Let us take a moment to better understand our bodies and appreciate the remarkable natural systems that work every day to protect us. I hope today's discussion provides useful knowledge and helps us become wiser in taking care of our ears. Today, we are going to discuss a very common question. Is it safe to clean your ears using cotton swabs? Many people use cotton swabs with good intentions. They want to keep their ears clean and may feel that earwax should always be removed. For some people, using cotton swabs has even become part of their regular hygiene routine, similar to brushing their teeth or washing their face. However, from an ear health perspective, inserting cotton swabs too deeply into the ear canal is generally not recommended. One important reason is that the ear already has its own natural cleaning mechanism. Earwax, or cerumen, is not simply something that needs to be completely removed. It is part of the ear's natural protective system. It contains natural oils and other components that help maintain the condition of the skin inside the ear canal and trap small particles. The ear has a natural process that gradually moves earwax from deeper areas toward the outer part of the ear. Once the earwax reaches the outside, the visible portion can simply be cleaned gently. Problems can arise when a cotton swab is inserted too deeply. Even though you may see earwax on the cotton tip afterward, some of the material may actually have been pushed farther into the ear canal. As a result, a habit intended to maintain cleanliness may instead cause earwax to accumulate deeper inside the ear. In addition, an accidental movement can irritate the delicate skin of the ear canal. There is another point worth considering. The cotton material on the tip of a cotton swab can sometimes become detached and remain inside the ear canal. If this happens, it is better not to try removing it with another object. Having it checked by a healthcare professional is a safer option. So, does everyone need to clean their ears regularly? Not necessarily. For many people, the ears are capable of naturally moving earwax outward. Therefore, regularly cleaning deep inside the ear is usually unnecessary. However, some people are more prone to earwax buildup. In these situations, professional evaluation or appropriate treatment may be needed. The method should depend on each person's individual ear condition. This becomes especially important for people who have a history of a perforated eardrum, changes in the ear structure, previous ear surgery, ear tubes, or certain ear conditions. In these circumstances, it is better not to try home ear cleaning methods without first consulting a healthcare professional. The same principle applies to people with certain health conditions, such as diabetes, a weakened immune system, or a history of radiation therapy involving the head or neck. For some individuals, home ear cleaning methods may not be appropriate, making professional evaluation a better choice. So, when we see earwax, we should not immediately assume that all of it needs to be removed. First, we need to understand that earwax has a natural function. If there are no symptoms and the earwax is only present around the outer part of the ear, simply keeping the outer ear clean and gently maintained may be sufficient. Avoid inserting objects deeply into the ear simply to make sure it feels completely clean. If the ear feels blocked, hearing changes, or earwax appears to be accumulating and does not naturally move outward, an examination may be appropriate. A doctor can assess the ear canal and determine whether cleaning is actually necessary and which approach is suitable. Through this discussion, I would like to encourage everyone to change the way we think about ear hygiene. Healthy ears do not necessarily mean ears that are completely free of earwax. In fact, a normal amount of earwax is part of the body's natural protective mechanism. Do not continue a habit simply because you have been doing it for years. We can always improve our habits when we learn better information. Taking care of our health does not always require doing more. Sometimes, knowing when to stop doing something is also an important part of self-care. I hope this explanation provides useful information and helps all of us better understand how to care for our ears. The moral of today's discussion is simple. Do not measure cleanliness only by what you can see. Understand the natural functions of your body, avoid excessive habits, and do not hesitate to seek professional help when your ear condition requires special attention. Caring for our bodies with knowledge, patience, and caution is one meaningful way to be grateful for the health that God has entrusted to us.